Good evening and thanks for joining us. It is January 25th, 2021, exactly 1 year since a single story began to dominate the headlines. Coronavirus confirmed in Canada. One official case, another presumptive case. Their connection.
This new case isn't surprising.
Plus, new questions over how the virus spreads. Now it's 1 year later, after more than 19,000 Canadians have died of COVID-19, and there are still questions about how it spreads and mutates. The most urgent concern right now, those highly contagious new variants, which spread much faster. It's not known how prevalent those variants are in Canada. Finding them requires genomic sequencing, and not every positive case goes through that. A handful of cases of the variant first detected in South Africa have been confirmed in Canada. So have dozens of cases of the one first discovered in the UK. In Ontario, 34 people are known to be infected with the UK variant now, and it's feared it is present in a second Ontario long-term care facility. In Alberta, it was confirmed today there are now 20 cases of the UK variant. 19 of them are known to have a connection to travel. One does not. That is an indication it is spreading in the community, which the health minister said today is very concerning. Here's what could happen. New modeling from Simon Fraser University suggests if a more contagious variant takes hold in the community, the situation could lead to a sharp spike in cases, that red line. SFU researchers say tougher measures are needed, including stricter travel rules to prevent a looming disaster. The federal government is considering imposing new measures to restrict who comes into Canada and to discourage non-essential travel. Mike Le Couteur is following that tonight, plus the latest on the delay in vaccines. Mike?
Well, Donna, government sources tell Global News the Liberals are looking at ways to tighten up the Canadian border to outside travelers. Now, the Emergencies Act is still on the table, and we're hearing new measures to limit incoming travel could be coming very soon.
I also encourage the Prime Minister, close down any travel coming into Canada outside of residents of Canada.
Ontario Premier Doug Ford couldn't be more clear. He's worried that without a hard border closure, too many cases of COVID-19 and its variants are coming into Canada.
So if I'm doing my math correctly, 2.5% of 30,750 people slipping in through the border that have COVID.
There is already a requirement for travelers to have a negative COVID-19 result before getting on a flight for Canada. But the Deputy Prime Minister is hinting more is coming.
Our government absolutely is looking seriously and carefully at measures to further guarantee the toughness of our border measures.
The NDP says it's willing to work with the Liberals on a forced quarantine like Australia. There, people must stay in a hotel for 14 days upon arrival, a move that could be necessary as the virus spreads and the flow of vaccines has dried up for this week.
Next week, our order has been cut by 86%.
The opposition hammered the government on the lack of Pfizer-BioNTech vaccine deliveries. It's caused by retooling at the plant in Belgium. But the opposition wants to know why other supplies are off limits.
There are vaccines being made not far from us in Kalamazoo, Michigan. Did the Prime Minister ask for the ability to have that plant used?
The government says doses made at the American plant are earmarked for the U.S. in the first quarter of this year. And they maintain Canada will have the full order of 4 million doses by the end of March. Donna?
Mike Le Couteur in Ottawa, thanks. A big question is how effective are the vaccines against the variants? Moderna said today its vaccine appears to work against the variant from the UK once both doses have been given. It also protects against the South African variant, but a booster shot may be required. Crystal Goomansingh on what we know so far about the vaccines and the variants.
When it comes to fighting COVID-19, your system needs neutralizing antibodies. Vaccines deliver the code to build them. The code delivered in the Moderna COVID-19 vaccine is less effective against the South African strain. A study by the drug company suggests the vaccine's effectiveness is reduced roughly 6-fold. However, when it comes to the UK variant, the vaccine produces the same level of neutralizing antibodies.
We see very high level of antibody with a B117 strain from the UK.
Health officials in multiple countries say the data is helpful, but does not change the current recommendations.
For the purposes of the vaccine rollout, whether people have had the old or the new variant, it doesn't matter. What you need to do is get vaccinated when the call comes.
There seems to be a considerable more threat to vaccine efficacy, even though the cushion of efficacy is sound enough that the vaccines that we're using now will be good against both the mutant in South Africa as well as in the UK.
If any country bets everything on the vaccine, we're going to lose. That's the bottom line. The vaccine is one tool.
Moderna is working on a booster shot based off of the South African variant. There are also other vaccines in trials and new therapies being studied.
I think we're going to be going into a period where we'll want to be seeing even more collaboration across producers to try and then together look at how do we both assess the changing environment we're in.
An environment made all the more challenging with the continued and rapid spread of the virus. Crystal Goomansingh, Global News, London.